everybody. My name is Zachary Horner. I am the Communications Specialist for the Chatham County Public Health Department. I am here this afternoon with Mike Zelek, the Interim Public Health Director for Chatham County, and we're going to be asking a few questions about COVID and what it means for the Chatham County community. Mike, how are you doing this afternoon?
I'm doing well, Zach. Thanks for having me. Thanks for organizing, and hello to everyone out there in Chatham County.
All right, we asked and we got a few questions from the community, and we've got a few of our own that we really want to cover this afternoon to help you guys understand better how to keep living in this pandemic that has been going on for more than 6 months now. So Mike, first of all, where do Chatham County and North Carolina stand right now in terms of COVID-19 numbers?
Yeah, thank you, Zach, and thanks for everyone who reached out with questions for us. We really appreciated you all taking the time to share your thoughts and your questions, and we're happy to respond to some of them. So looking statewide in North Carolina, there's some concerning trends around COVID right now. Cases, hospitalizations, and the positivity rates are all increasing. Just last week, we set some new daily records in terms of confirmed COVID cases statewide. That's very concerning to us in the public health community, as well as these record highs in hospitalizations. In Chatham County, we haven't seen quite the same uptick recently. We've been holding fairly steady over the last several weeks. However, given these trends statewide and also in our region, we're very concerned about this, considering we're approaching these colder months as well, when folks tend to gather inside. It aligns with flu season as well, so get your flu shot. But these things are weighing on us, and it's only reinforcing to us the importance of practicing those 3 W's, the wear your face covering, wait 6 feet apart, and wash your hands.
That was going to be my next question. Why, we've heard about the 3 W's for months now. Why is it still important to practice those things?
Absolutely. Well, the 3 W's are really the key tools to slowing the spread of the virus. But not only that, it's about doing the activities that we all enjoy safely. And so if we want to get back to some of those activities, these are important measures to take to do that more safely and to limit the spread of the virus. Keep ourselves safe, keep those around us safe, and limit the spread. There's more research coming every day about face coverings, for example. So people ask about the mandates. What about face coverings? Why do we need to wear them? Well, the research continues to show just how important it is when we all wear face coverings, when we're around each other, with those who are outside of our household. When we wear them consistently and we wear them correctly, they go a long way in terms of limiting the risk of spread and risk of infection. So we continue to encourage everyone, wear your face covering. If you go out, if you're in the store, if you're around others, if you're outside of your household, around other people, especially indoors, if you can't maintain that 6 feet of distance, get your face covering, wear that consistently and correctly. Over your nose, over your mouth, consistently.
That's right. If you want to learn more about face coverings, head to chathamnc.org/face coverings to a little bit more. We've got a lot of resources on there about that topic. What are we doing? What are we as a public health department doing right now on a day-to-day basis to respond to the pandemic locally? I know that we've been hitting the pavement pretty heavy since March. What are we doing right now?
Yeah, the COVID response as a local health department includes staff across the agency. And not only that, it includes our partners like emergency management and several others around the county. And I'll say it includes you. It includes all of the Chatham County members of the community coming together, taking the actions to slow the spread of the virus, like following the 3 W's. We can't do it alone. We need to do it as a community. And we're really proud. The Chatham community has responded. That's why we haven't seen the uptick that some others are seeing, but we have to keep doing this. We have to keep doing it consistently and properly and correctly to slow the spread of the virus, because the virus wants to spread and it will take every opportunity it has to do so. So keep taking these preventive measures to slow the spread of the virus. In terms of what our response looks like as an agency, things like responding to positive cases, close contacts, things like that. You hear about isolation and quarantine, those activities, but it's more than that. It's responding to concerns from the community, questions from the community daily through our info line, through our website, social media, questions that the public has about folks in the community maybe not practicing the 3 W's, wearing their face coverings. It's sharing data and information and guidance with you, with the community, with our partners, with the medical providers around There's so much to the response. It's daily or weekly conversations with businesses and childcare centers and the school systems and long-term care facilities, and responding to cases in those settings and doing everything we can to slow the spread and prevent clusters and outbreaks in those settings. That's just a snapshot of what we do. Every day looks a little bit different. The virus always keeps us on our toes, but we've been preparing for it. We've been responding to it, and we remain committed to doing everything we can to keep the Chatham County community safe and healthy.
Definitely. I mean, I think every department across the county government has been stellar in their response. The libraries, DSS, the sheriff's office, council on aging, and the list goes on. So we're so grateful as an agency to have those kind of partners. Um, a lot of people, we're starting to hear more about COVID-19 testing now that's becoming more widely available. And there are some that are like, well, there's different kinds of tests. So what are the different kinds of tests right now that are out for COVID-19? What are the similarities? What are the differences? What can people expect from those kind of tests?
Yes, that's a great question, Zach. I'll focus on two types of tests. So let's keep it simple. There are tests to show you if you're currently infected, and there are tests to show you if you have been infected. So if we're looking at the currently infected tests, the diagnostic tests, as we call them, most commonly those are PCR tests, which are done typically through nasal swab. So you'll get a nasal swab, and on average, 2 or 3 days later, you'll get your test results back. Those tests are very accurate, and that's an advantage to them. They do take a couple of days, and that time has gotten shorter as we've gotten more capacity in terms of testing as a system. There's also antigen tests, which you may have heard of more recently. Those are becoming a little bit more readily available, and those are rapid tests. So they take about 15 minutes to deliver the results. On the downside, they tend to be a little bit less accurate than the PCR test. So PCR tests are still the most commonly used, even given their a little bit of a delay in terms of test results. But the antigen tests are now another option there if you really need a test result very quickly. And then on the past infection tests, we're looking at antibody tests. So your body develops these antibodies as an immune response to infection. And so this test goes looking for those, which shows you if your body has had that type of response, which indicates that you were infected by the virus. So it can show you if you previously been infected. So I focus on those two kind of the tests, the presently infected and the past infection as well. That kind of sums up where we are today.
Definitely. And you've received a COVID test in the recent past, am I correct?
I have. I've actually done both types of tests, and looking at testing options in the community. I was tested here in Chatham County through a recent partnership we have with the state, DHHS, and StarMed. StarMed is set up now to do testing, drive-through testing. It's free of charge. Thursdays at Northwood High School and Mondays at Chatham Central High School. So those are two great options, and they complement other testing resources in the county, including Chatham Hospital in Siler City, Piedmont Health Services, Siler City and Moncure, and then a number of urgent cares and some pharmacies in the county as well. So testing access has expanded certainly in recent weeks and months. We're, as a health department, always looking to continue to increase access to testing and make it available to our community members, especially free and no-cost, low-cost testing options as well. So that's out there. And if you want more about the testing options as well as what to do while you're awaiting your test, especially if you've been exposed or you have symptoms, rule of thumb, stay home if any of those apply. Go to chathamnc.org/coronavirus testing, and that'll give you the list of testing options in the county as well as some more information about testing.
Definitely. How did it feel to get the nose swab? What was that like?
It wasn't too bad, Zach. There are different ones that they do, and for me, it was worth it because then I could know if I had active COVID infection. So a couple days later, I got my results. Thankfully, they were negative, but that doesn't mean that I'm protected forever. Again, the COVID test is a point-in-time test, so it tells you what's going on right then. And so just keep that in mind. That's not a pass to do everything you want and to ignore the 3 W's. It just tells you at that moment it did not detect active COVID-19 infection.
Awesome. Great to hear. So we've talked about what's been going on in the past. Let's look to the future right now. Obviously, Halloween is right around the corner. How should people address and approach Halloween this year? Obviously, we assume that it's going to be very different from past years, considering the way that the coronavirus spreads. What are we suggesting? What do you suggest that Chatham County families do as they approach Halloween, especially considering where we are with the trends?
Yeah, that's a great question, Zach, and I appreciate you bringing up the trends again statewide. Again, we're looking at some increases recently, and as we get in these colder months, again, now is not the time to be complacent. Now is the time to practice these three W's as consistently and correctly as ever. So when we look at something like Halloween and a holiday that many of us enjoy, we've developed some graphics to discuss some safer options and activities for the holiday, for Halloween. And we will share those with you on this video. We encourage you all to practice the lower and more moderate risk activities and avoid the higher risk activities. But again, the same rules apply as always, the three W's. So avoid gathering in groups in close proximity, especially indoors. Wear your face covering, good hand hygiene. All those same rules apply. Whatever setting you're in, those are the things you need to keep in mind. And that certainly applies over the holidays. Unfortunately, the virus, it doesn't care if it's Halloween or whatever day of the year it is, it'll take every opportunity to spread. So please do your part to keep the virus from spreading.
Yeah, so as we mentioned, a week to Halloween, we're a month away from Thanksgiving, 2 months away from Christmas. How should we be thinking about that as we move forward? What are we supposed to do, basically, as we approach these two holidays that are known for and traditional about family gatherings, large gatherings, people being together in this time of coronavirus?
It's a great question. I know it's on the minds of many right now. And again, we're concerned about these trends in COVID-19 statewide and in other counties nearby. We don't know what things are going to look like in a month. We don't know what things will look like in 2 months, but what I'd say is that general principles that we've been talking about around the three W's, they still apply. So looking at these holidays, when we think about people coming together, the more people you have, the closer the space, the closer the contact, the longer the period, indoors, without face coverings, that's where the virus, that's every one of those things is just amplifies the risk of the virus spreading. And so what I would encourage is, again, the three W's, doing everything you can to limit that close contact. And if you are nearby others, to wear a face covering. Those actions go a long way in slowing the spread of the virus. And of course, if you don't feel well, or you know that you came into contact with somebody who has COVID-19, stay away from those gatherings. Don't put your family and your loved ones at risk. That's critically important as well. So again, the same principles apply, three W's, and again, avoiding that kind of sustained close contact, especially indoors. The more that happens, the more the virus will take hold, the more it'll spread through our community. But Chatham's doing a great job, and I just want to echo it. We do have some control over what the future looks like. If we consistently practice the three W's and follow this guidance, the number of cases will decrease and our community will be healthier, and we'll be able to get back to more of a sense of normalcy and do more of those activities that we all enjoy. So that's what I look like. Unfortunately, the virus doesn't know that it's Thanksgiving or Christmas or Hanukkah or New Year's either. It's just going to take opportunities that it has to spread. And we just appreciate the Chatham County community doing its part, everyone doing their part to slow the spread of the virus.
Definitely, like you said, you could be going to one of these gatherings and not feel any effects and still carry the virus. And so even if you think, oh, I'm fine, I don't feel sick or anything, it's still really important to take those precautions, even then. So that was one of the submitted questions. We have another submitted question about one of the three W's. What can be done to enforce the face covering mandate? Of course, back in late June, Governor Roy Cooper gave out an executive order that required face coverings for North Carolinians in most, if not all, public places. What can be done to enforce that if someone is at a location where they're not seeing the face covering mandate being followed? What can people do to respond to that?
Yeah, another great question. First, I'd just like to say we appreciate everyone doing their part to wear that face covering consistently and correctly when they're around others out in the community. It starts with each one of us. That's where it begins. That's the crux of it all. If you have concerns about what you're seeing out there in the community, if you see, whether you go into a business or something like that, or a setting where you see close contact and maybe employees or others aren't wearing face coverings, we have an info line you can call, and our COVID response team will follow up with that setting to remind them of the executive order and, of course, of the importance of wearing face coverings consistently. So that's just another thing that we're doing regularly. We'll put up the phone number there for you to call, and you can let us know and we'll follow up on it. But again, it starts with each of us. We appreciate everyone doing their part to follow this guidance and to keep our community healthy.
Definitely. Definitely. So thankful for that. We put out a survey earlier this year. More than 90% of the Chatham community says that they are following the 3 W's, each one of them. And so that's so encouraging for us. Of course, wearing a cloth face covering, waiting 6 feet apart, and washing your hands regularly, which we're missing from the board back there, but we do still encourage that. We encourage that year round, in fact. So there we go.
Here's the third W. Zach, thanks for reminding me. I'm glad to hold it up. It's also important, and it helps to slow the spread of the flu as well. Get your flu shot, wash your hands, and of course the other 2 W's, wait 6 feet apart, and wear your face cover.
Definitely. Washing your hands is good advice year round, pandemic or not. So definitely always encourage that. We talked about holidays and being around family. How do we know what activities, family or not, are the most risky right now? Are there things that we should keep in mind when we're going to a gathering, if we're going shopping, going to school, and we got kids coming back to school here in Chatham County, exercising? What should we keep in mind when we're thinking about participating in those activities?
Yeah, you talk about a lot of activities that are vitally important to the Chatham community and things that we enjoy. I shared a lot of it when I talked about Thanksgiving, but again, think about how well those 3 W's are being followed. We're constantly sharing guidance with the Chatham community, whether it's school settings, whether it's workplaces, other settings, sharing the guidance that we have. We know that people like the school system, for example, are being very thoughtful about how they plan and execute the guidance that's coming to them. And of course, we're working in close consultation with them, as we are with a number of other settings. So again, if you think you're going somewhere where people are going to be close together, there's going to be a large group, 6 feet of distance between people cannot be maintained. It's going to last a long time. You're going to be indoors. Face coverings aren't being worn. If you don't feel comfortable that those things are taking place, that's a sign that that's probably not the best place for you to be. But again, what we've seen when we work with folks, when we talk to them out there, a lot of places, they're doing what they can do. They're being very thoughtful and proactive in terms of the measures that they put into place to ensure that those 3 W's are being followed. And so we're very grateful for that, because that's part of the pandemic response. And so thank you, Chatham County community, for all you're doing to slow the spread of the virus. And if you have any questions of us, we have a business reopening guide as well. We have a number of resources on our website to help you safely reopen or safely function in this pandemic environment. So we appreciate everyone doing your part, but those are the general principles that apply and things to keep in mind when you're weighing the risks of COVID in a specific outing or event or gathering.
Definitely. You mentioned our website, chathamnc.org/coronavirus. On that page, you will find links to guidance from the North Carolina Department of Health and Human Services to certain types of businesses, to childcare facilities, to long-term care facilities, religious gatherings that can help guide what to do in those situations. And then if you're going to those places, what to look for, what to see how they're doing. A lot of talk about the vaccine. Obviously, vaccines have played a significant role in public health over the existence of public health, really. The COVID vaccine is on its way at some point soon. Where do we stand on that? What is the status of that vaccine?
You know, there's a lot of research going on around the vaccines, around medical interventions, therapeutics, they call them, for those who get infected to reduce the severity of illness. In terms of vaccines, vaccines go through these trials, they call them, as part of the research process, and there are different phases of the trials. So most of the vaccines are currently in phase 3. So you start small to see if there are adverse kind of side effects, negative impacts to health from the vaccine, and then you grow them to also study. In addition to those issues, you study the effectiveness of the vaccine in terms of its impact on disease severity or presence if you become infected. And so many of the vaccines are a little bit further along in phase 3, which is where the sample size, the number of people who are being studied or enrolled in the study has grown into the thousands. And we have some partners like UNC Health, Duke, and others who are part of these larger trials of vaccines. What these trials do, again, they study the safety of the vaccines and they study the effectiveness of the vaccines. And that's how we know the answers to those questions. And so that process is ongoing. It takes time, and that's why there hasn't been a vaccine out there more broadly yet, but we are already working as a health department to plan for the day that the vaccine is available to get it out there. And we'll certainly be sharing more information as that process unfolds. So that's where we are. Again, it's in the research process to, again, do its due diligence in terms of studying the effectiveness and safety of the vaccine.
And we're so grateful for our partners. You mentioned UNC. And for those around the world that are really giving their time and their effort to get something that's good for everyone. Lastly, another thing we've heard a lot about, herd immunity related to COVID-19. What is herd immunity, and do you think it's a good strategy to respond to this pandemic?
Yeah, so herd immunity is this principle that once a certain number of a percentage of the population becomes immune, whether through infection or through vaccine, that the risk to the society as a whole becomes low. Basically, the virus or the disease cannot take hold in a community. When it comes to COVID-19, remember, we don't yet have a vaccine. The herd immunity approach is not one that is supported broadly in the public health community. We at the Chatham County Public Health Department do not believe that this is a safe or responsible approach to slowing the spread of the virus or to responding to the pandemic. How we slow the spread of the virus is following the 3 W's and doing all of our part as individuals and collectively to ensure that it doesn't take hold in our households, in our communities, and in our county. We remember, we don't have a vaccine. To reach herd immunity, you need a fairly high percentage of the population having immunity. Immunity questions are still unknown in terms of do you have immunity? How long does it last if you become infected with the virus? So if we're looking at, again, we don't know exactly what percentage of the population would need to be immune for herd immunity to be viable anyways, but it would be substantially larger than what current infection indicates, likely well over half of the population. And so what that means, if this approach were pursued, you would have a lot of people who died. You would have a lot of preventable deaths that we're working day in and day out. This team and all of us as a community are working day in and day out to prevent. The way we protect the vulnerable is all doing our part to follow the 3 W's. That's how we keep the virus out of these more high-risk settings like nursing homes, where over 80% of deaths have occurred in Chatham County. So we appreciate everyone doing their part, but no, unfortunately, herd immunity is not a viable option right now. It's not a responsible option right now. And we just encourage everyone, please continue to follow these 3 W's. The researchers are working on a vaccine. We're preparing for that outcome. Once it's ready for us, we're getting ready to distribute it. We don't know when that's going to be. I know we all want this thing to end. I get it. You get it. We all get it. But we all need to do our part to slow the spread of the virus. That's how we stay safe. And that's why I'm so proud of the Chatham community, because we've all done that. And we've really, while other communities have seen an uptick because people are doing these things, we've been able to keep it more or less in check. But we have to keep that going, because if we let up for a second, it will take hold. Our rates will increase. Our hospitalizations will increase. and the risk to those who may be at greater risk of severe illness will increase. So we thank you all for doing your part. We thank you for your questions, and we thank you for continuing to keep Chatham County a healthy and wonderful place for all of us.
Definitely. Mike, thank you so much for taking the time this afternoon to answer some questions. We really appreciate it.
Absolutely, Zach. Thanks for organizing, and thanks for everyone for your questions. We'll do this again.
Of course. And as always, make sure you're wearing your mask over your nose, under the chin, nice and snug.
Take care, everyone.